everyone. I'm sure that I've met many of the people who are joining the session today, but just in case there are people who I haven't met before, I'm Councillor Mariam Khan, the Cabinet Member for Health and Social Care, and I'm certain that everybody here knows Dr. Justin Varney. As we've got an hour to get through and share with you all the work on Black Here, I'll begin now, and for anyone that is still joining us or actually unable to join us, we are recording this webinar, as Dr. Justin Varney's just stated, so people will be able to watch this back. So this webinar is part of our month-long virtual conference, Global Communities, Local Challenges, Partnership Solutions. And over the month, we've got over 30 webinar sessions happening, ranging from sessions on promoting physical activity with African and Caribbean communities to sharing good practice in understanding ethnicity in the concept of population health management. You can find out more information on these on the Birmingham City Council website. I'd like to thank everyone that has joined us so far for joining us today. And before we go straight into the session, I would like to quickly hand over to Dr. Justin Varney for some quick but important housekeeping.
Great, thank you, Councillor Khan. So just to say again, we'll be recording today's session. That recording started. If you want to raise a question, please use the raise hand function or pop your question in the chat. If we're still talking, it's probably easier to use the chat than interrupt the flow. We suggest people keep their cameras off because it would just help the pressure on other people's bandwidth, and keep yourself muted because again that stops any background noise of doorbells going off or people popping into your office while we're talking. There will be a post-event survey because we want to get feedback so we can build on this approach for future years, and Eloise will pop that in the chat for colleagues as well, so do give us your feedback afterwards. But I'll hand back to you, Councillor Khan, to say some words of intro.
Thank you, Justin. So I'm delighted to be with you all and share what we have been doing with Black Here. As Black Here was something that we're very proud of in Birmingham because it's a real partnership between the council, our local communities, the NHS and academic sectors, and also, of course, with Lewisham as well. It's important for me, of course, to acknowledge my predecessor, Paulette Hamilton MP, who supported this work to get off the ground and championed it to continue even when the world around us was turned upside down because of COVID. She is a force to be reckoned with and has continued to support the work from within Parliament. The partnership with Lewisham was also absolutely key to this, and the political and office support, as well as our work with partners and communities, kept things moving forward and kept the work both action and solution focused. Our community partner organisations have been vital to this, and I particularly want to acknowledge the generous wisdom of Black Thrive Birmingham, who have been an important, critical friend of our work. So thank you. And I'd also like to pay tribute and say thank you to the citizens who've helped us on the journey, and they continue to give their time to co-create sustainable change for a better future. This hasn't been an easy journey, but if we're going to achieve an impact that turns the dial and prevents future generations experiencing the unacceptable burden of inequalities that Black Here highlighted in response to, then it is time and sweat well spent. I am incredibly proud that we remain committed to this important piece of work, and that the learning is now also having a positive impact for other communities beyond just our African and Caribbean communities. It is genuinely a very crucial piece of work that I've been proud to be part of since I became the Cabinet Member for Health and Social Care in Birmingham. And I'm really pleased that we've managed to get it to this stage, and it wouldn't be possible without all of the help and hard work of all the partners that have been involved. At this stage, I'll hand back to Dr. Justin Varney, who will be able to talk us through the journey that we've taken so far. And obviously, you've got some really helpful detailed slides to accompany that as well. So I'll hand back over to you, Justin.
Thank you, Councillor Khan. And I also just want to acknowledge that political support, both from yourself and from Councillor Hamilton, when she was our councillor, rather than our MP. We can't do this work without political air cover. It is difficult space, it is challenging space, and it is the political support that has kept this going as well. So I do want to say thank you to you for your ongoing support in the space. So why did we do it? Well, Black Here originally came out of a conversation between myself and my counterpart, Catherine, who's the Director of Public Health in Lewisham, at an event we were both at talking about childhood obesity. And we were getting increasingly frustrated at the discussion of BAME, all ethnic groups just homogenized together. And we were kind of sitting down having coffee going, well, this isn't good enough. And how can we change this? And we said, well, if no one else is going to change it, why don't we do that? And we were fortunate to have Paulette Hamilton with us then, and Councillor Best from Lewisham were at the event as well. So we kind of nobbled them, had a chat, and out of that came the Black Ear piece of work. And it was really recognising that health inequalities aren't inevitable. We can change them. Both Lewisham and Birmingham have large, diverse, and vibrant African and Caribbean communities, and we need to do more to understand them. It's not good enough to just go, all Black people are the same. There are cultural differences, there are belief differences, there are differences in health inequalities between African and Caribbean communities, and certainly in Birmingham we are large enough to see those differences and to not take a homogenized approach. But actually that changing the inequalities, tackling those things, turning the dial in the right direction is going to need a really different approach that's around structural change and sustainable change. And Black Ear therefore needed to be something that was very solution focused, but also that was honest and realistic about the challenges that faced us. This is a screen grab from our Birmingham City Observatory, where you can find lots of information, particularly from the census. But it just gives you a sense of, from Birmingham's perspective, that it's about 11% of our population identify with one of the Office of National Statistics, Black African, Black Caribbean, Black British categories. And that's about 125,000, almost 126,000 people. That is the largest population of African and Caribbean people in any local authority in the country. In Lewisham, it's a slightly different picture in that they have 26.8% of the population come from the African and Caribbean community, so it's their largest ethnic group. But when you look at the total number of people, it's only about 80.5. 100,000. So it's a different, they've got a smaller population, but a larger proportion of their population from the community. So that's why we chose to work together in this space. And also because we recognized at the start that this was going to be a difficult journey, and by working together in two areas with our communities, which are slightly different, they're different in terms of the makeup of countries of heritage, they're different in terms of the year's migration patterns and the pattern of migration, they're different in terms of the age profile. So by actually joining up, we were able to have a much richer set of conversations. But the inequalities that we found through the research, and many of these are well known and have been around for decades, increased experiences of hate crime, worse outcomes in relation to cardiovascular dementia, worse experiences of the criminal justice system, increased risk of child poverty, higher maternal mortality rates, the list go on. But Black Ear wasn't about just restating this inequality. It was about focusing on solution. But when we started Black Ear, we were really clear. It was about saying this is not okay. These inequalities have been going on for decades. Every time I see the headline around the proportion or the increased risk of maternal mortality, women who die during pregnancy amongst Black mothers, it feels like that's new news. That disproportion, that inequality has been present for decades. Ever since I was in medical school back in the 90s, we knew this, and yet we're not changing it. And the point of Black Ear was about going, how do we change this? What actually needs to change? Based on the evidence, based on people's lived experience, how are we going to move the dial? And so we set up a governance structure, which was about us having an academic board, which brought together people whose careers are around research and evidence in relation to ethnic communities, and specifically in relation to African and Caribbean communities in the UK. We also established a community advisory board, and we recruited members through an open recruitment process. to represent the different communities and help shape the recommendations. And then the two public health teams in Birmingham and Lewisham work together as well. We also commissioned a partner agency to help us encourage and support young people to be involved. And we also did that through our youth service, so that we wanted to make sure that the next generation were part of the table and part of the discussions about solutions. And as we developed outputs, and I'll talk more about that in a second, we tested those with local communities. So we ran webinars like this, we ran online surveys, we ran engagement events so that we could test whether the recommendations we were making, those opportunities for action, would actually land, and also whether the communities would say, you know what, this is something different. We feel we have some confidence it will take us somewhere new. So we took a thematic approach, and it's important to recognise as we were doing this, we were moving into the COVID pandemic. And I think one of my reflections of learning is if we were doing this again, we might spend a bit more time choosing the themes, and we might have more themes to break some of these down a little bit more. But for each of these themes, we spent time looking at the academic evidence. So we did a rapid evidence review. That review was then considered by the academic board, who then, drawing on their experience and the academic papers, pulled together a first stab at recommendations, things that could be done to change the inequalities that were being identified. And then both the academic report and the recommendations went to the external advisory board, that community board, to kind of consolidate and work through that. And people were really honest and blunt and played back. Many times, you know, this is all very well and good, but if we take something like training on diversity, we've had that for decades and it hasn't changed. So let's have a real conversation about what we want to see different about training healthcare professionals, social care staff to work with our communities. And that led us to I think, a much richer set of recommendations. We then took those, as I say, through engagement with wider communities and also with stakeholders. We tested it with colleagues in the NHS, in schools and education, so that they also had a chance to go, this makes sense, or, you know, this won't work and why, and talk that through in more detail. So when we published the report in June 2022, the report has 7 key areas for action, and they're key areas for action because these are cross-cutting. These are things that don't neatly sit in a box for any one organisation to do. They are really quite fundamental changes that need to happen. And the 7 areas include things like fairness, inclusion, respect, trust and transparency, better data, earlier intervention, different approaches to health checks and the way we communicate, health education, health awareness campaigns, specific, more culturally competent work around health behaviours, and working with communities to support stronger health understanding and health literacy. Alongside those 7 core themes are 39 detailed opportunities for action. And the opportunities for action are quite specific. So they talk about a specific organisation or a specific partnership like the NHS integrated care system that needs to do something. So they are much more specific actions, and that's why there's a lot of them. And they align to the different themes. So under each theme, there are specific clusters of opportunities for action. The report, when it was published, was fully accepted in its entirety by Birmingham City Council and by Birmingham Solihull Integrated Care System. So that's our local NHS governance system. It's also been endorsed by the NHS England Director of Health Inequalities and is being used as a benchmark for good practice nationally, within other NHS governance systems around the country being asked to respond to it and what it's saying about recommendations. Because I don't think there's anything in it which is specifically Birmingham or isn't applicable to other parts of the country when it comes to improving outcomes and improving the lives of our African and Caribbean citizens. One thing I do want to share is we really wrestled and thought about how can we make what could be seen as a really dry technical report interesting and engaging, and we reached out to Casey Bailey, who at the time was Birmingham's Poet Laureate, and we commissioned him to write a poem inspired by Black Ear. And I really encourage colleagues to have a look on our council website and read the poem, because it has been really powerful at communicating why the review is important and why this resonates and resonated with Casey personally. And it was a good example of using creativity and creative arts to communicate what could be seen as kind of boring technical stuff in a way that actually people engage and respond to. And it's been particularly powerful helping young people connect with it and connect with its messages. So what have we been doing since June 2022? Well, we've been getting on with implementation, and that has taken a bit of time. So we set up an implementation board, which is chaired by actually co-chairs, independent co-chairs. And the reason we wanted independent co-chairs is their job is to hold us to account, to keep us moving forward, and to provide a level of independent challenge. We commissioned 3 community partner organisations to work with us to help engage wider community members in the work and help keep us real and committed to that citizen voice and anchoring what we're doing in citizens and their perceptions, their experiences of the city. And it's important to say, as we move to implementation, Birmingham Lewisham parted ways in a sense. We stay still talking to each other and we have regular touch base to share learning, but we recognise that how each local authority implements these recommendations needed to be different, and we needed to be free to move at our own pace within the context of what's happening for us. So moving from the implementation board, we've been working to set up 7 co-production groups focusing on the 7 areas of action, and that's led through the public health team. And then we have 2 delivery groups, one which is led by the NHS, by Dr. Oni, who will be doing a webinar later in the month to share what the NHS has done specifically on the NHS-focused opportunities for action. And then one which is led within the council by our assistant director, who has equalities in his portfolio, and that's taking forward the specific recommendations that apply to the council. What was also important to us, and citizens really fed this back to us, is it's great to write a nice report, but actually who's going to hold you to account that you're delivering it? So not just me, but also Councillor Khan as our political sponsor for this. And so the board and the implementation of Black Ear formally reports through to our statutory health and wellbeing board, which is a formal subcommittee of cabinet. So publicly we report on an ongoing basis to that board and give updates on progress. Just to give a bit of an insight into some of the things we've achieved over the last year or so in the work streams, and particularly in the kind of 7 key areas. So the key themes around trust, respect, and inclusion. We did some work over the autumn last year, exploring these in co-production with our partners, and really reflecting, well, what does that mean? What's the tangible thing that needs to happen? And that led us to exploring cultural competency and the literature and the evidence around cultural competency. And we divided cultural competency into 2 pillars. Cultural intelligence, which is around how do we make better, more informed decisions? How do we advocate and demonstrate allyship at a strategic level for diverse ethnic communities? And cultural humility and safety, which is more about how do we support people in their one-to-one interactions, whether it's staff and service users or staff to staff interactions, to be more culturally competent in those one-to-one interactions. And cultural intelligence, I pulled out here partially because it's a work stream that I co-led with the chair of Black Thrive Birmingham. And we co-developed a new framework for cultural intelligence. We looked at the evidence, we looked at existing frameworks, and we said what's out there doesn't quite work. It's not detailed enough, it's not respectful enough, it homogenizes ethnic communities and says, well, you can do this once for all ethnicities, and that's not good enough for Birmingham. So we co-produced a framework, and That framework is the diagram you can see on the right with the 7 domains of competency and practice. And we then tested those as we were developing them with staff predominantly from the council, but also some from our NHS partners. And we've then spent further work creating a technical toolkit and a kind of rollout strategy. And now the first workshops happened last week. We are testing that draft toolkit in real time with public sector staff with the aim that in December, we will launch the toolkit in its pilot phase with a number of organisations alongside an academic evaluation to demonstrate if this approach really is achieving behavioural and attitudinal shift in the staff. So this is not about a one and done. This is about developing a learning journey and trying to develop a tool that really does demonstrate impact and change in the way that individuals who use it interact with people from different communities from their own. One of the other areas that we have motored on and got movement on is around data collection and the use of data. And part of this is because alongside the work on Blackyear, we were trying to build a data dashboard. We wanted to build a kind of dashboard where you could see data which would allow us to show in 10 years' time the Blackyear indicators have moved. And what we discovered is that despite lots and lots of commitments to collect ethnic data, actually it's quite poor. And also when you delve into it, it's quite confusing. So because of that, we have moved forward in our data strands, and two things that have happened. So one is that within the NHS 10-year strategy for Birmingham and Solihull, we have set specific targets and ambitions around addressing inequalities for ethnic communities, particularly in type 2 diabetes, immunisation and cancer screening. But we've also set a public commitment to reduce the ethnicity pay gap, and that mirrors an existing commitment from Birmingham City Council. So where we could find data, we've now built it into strategies so that it's there as a very, very clear public ambition to close those gaps and make those changes. But what we've also done, and this is the first time we've presented this outside of our community engagement, is started to adopt new ways of collecting ethnicity data. So we've modified the census data collection tool, and that has been particularly to add in some ethnic coding that is not there currently. So for example, Latin American is not an ethnic code that is visible. Part of our engagement through the Blackyear project was questions were raised about why do we put Black in front of African and Black in front of Caribbean, that recognition that there are many people, particularly from the African continent, who don't identify as Black. So actually removing that whilst retaining the Black British identity, which many individuals who've migrated or second or third generation migrants in their heritage feel is important. So this was co-developed, and it was developed through a process of iteration backwards and forwards with our community partners and our staff diversity groups to develop this. And now this is being built into some of our commissioned services. But we also created a second question, which was asking around your countries of heritage. And that's because we recognise that many people, and particularly this is true for some of our Black British community, identify with a Black British ethnicity, but also identify with countries of heritage. And those countries of heritage and that heritage identity is really important to them as well. So we're adding in the second question to start to capture that and then be able to look at the data and what does it tell us. The third element of this, which we're just starting to explore, is questions about ethnic tribal identity. It's quite a contentious area. There are really different views, and one of the reasons we haven't gone yet, we're going live with it tomorrow, is because we want to explore and test this and learn. But it is important that we start to have conversations with people from communities where tribal identity may or may not be important about how relevant it is to them, so that we can better understand how we can support them. but it seems to be a kind of conversation that is quite missing in the discussion around ethnicity. And because of Black Ear, we've started to unpack this and started to explore it more. We've also tried to support and empower leadership through Black Ear, and I do want to acknowledge the contribution of Dr. Nicole Andrews, who sadly passed away during the Black Ear process. She was an academic from Newman University. I remember she joined the project. She talked to me really passionately about how hard it is as a Black woman within academia to have her voice heard. And she particularly focused her research on the experiences of African and Caribbean communities with our health and social care system. So one of the things we committed to as Black Ear was honouring her legacy and creating a joint academic post with Newman University. And we're now in the final stage of being able to move forward on a joint funded postgraduate doctorate in her memory, which I think will be really exciting. The other element where we've been supporting leadership is through the work that's supported by Mind's Eye, where they're supporting young people from African and Caribbean communities to be part of the Black Ear process, to have their voices heard, but also to become stronger and more visible community leaders in these spaces. And it's been brilliant. Every time I interact with this group of young people, I'm blown away with, you know, just what they bring to the table and how much passion they bring for building a better future in the city. Some of the impacts, some of the things that we've achieved, because we didn't wait till the report was finished. Some of this work started as we were doing the thematics, and as things were coming out, we're going, well, we can't wait until the whole thing's done. We need to get on and move things forward. So we've been working with the maternity pathway, particularly around experiences of African and Caribbean women in our maternity services. That's led to more insight work, more focus groups, specific commissioning of programs by the maternity network to improve access and address some of the inequalities. We piloted some different ways of delivering services, and it's been really interesting. Some of these have been really successful, some of them have been less successful. So we've commissioned what we call culturally competent approaches to mental health awareness and suicide prevention training. It's been, you know, it's been brilliant to work with different providers and kind of learn from them and hear back from them and from participants what's worked and what hasn't. In terms of how that's been received when we've specifically focused a package on a particular community, and has that been more successful than when it was universal. We've done some work around things like healthy eating guidelines and physical activity. You know, we had some feedback when we talk about physical activity guidelines. You know, as adults, we should all be doing 150 minutes of moderate physical activity every day. But moderate's a really kind of white British middle class word. You know, and it feels a little bit at times when I talk about moderate physical activity that I'm stepping out of an Agatha Christie film. You know, it's quite a hard thing to actually explain. It doesn't translate in some languages in the way that necessarily we interpret it. Or hear it. And so we've worked with community organisations to do some work around reimagining that and recommunicating it. And I know later in the month there are some sessions from other parts of the country where people have been specifically in the physical activity space looking alongside us in this. How do we communicate? How do we hear what's relevant for different communities when it comes to supporting behaviour change? And later this year, we will move into the second phase around the work we've done with the Diverse Nutrition Association to take the Eat Well Guide, the national guidance on how we should all eat a healthy and balanced diet, and reimagine it through the eyes of different ethnic communities and the foods of their heritage that resonate for them. Because again, the work that we did through Black Ear, some of the other work we had alongside in Insight, communities and families particularly were telling us they know what healthy is, but they don't want to eat white British healthy. They want to eat healthy in the context of their culture and their identity. And that also links into the work we're doing with our food strategy in the city around creating a diverse and healthy food environment, which is affordable and culturally diverse. And then finally, we took the advantage of the wonderful opportunity of having the Commonwealth Games last year to celebrate both physical activity and food through the prism of the Commonwealth. And there's a brilliant resource called Whisk, which is free and accessible to everyone, which has recipes now from every Commonwealth country. And those recipes were donated by citizens, by some of the restaurants in the city took part, and they were also looked at by nutritionists who went through them and tweaked them slightly, then tested them and made sure they tasted the same, but they made them a little bit healthier as well. So there's some brilliant stuff that's there available to everyone as part of the legacy and the growing body of legacy work that Blackie is creating. One of the other things that we've done, which I'm really phenomenally proud of, is the community health profiles. And this came out of really that fundamental starting point of it's not okay that we homogenize Black communities in this way and just say everyone's the same. You know, the idea that a Moroccan person living in the UK has the same health needs, the same health experiences, the same health inequalities as a Nigerian, as a South African is a bit bonkers. It would be like saying people in Birmingham are the same as people in Milan in Italy. Yeah, we do it every day. We homogenize these communities. And so what we tried to do with the community health profiles is start to unpack that. And where we've been able to, we've been building rapid needs assessments, which provide the data broken down by different countries. Where we're also able to, we also translate those into a first language for that country. And then we commissioned community organisations to work with us over the following year to take that information and talk to the communities that it affects in Birmingham and say, so what do you want to do about it? And as part of that commission, there's resources to pump prime activity, particularly within communities. So I know Eloise has popped those in the chat for colleagues to have a look at, but there's some brilliant resources there. And I'm really pleased that other parts of the country like Sheffield have pivoted and built on these and then done the Sheffield version, because our profiles do include Birmingham data as well as national data. So they've kind of done, and here's the Sheffield plug on, which is a brilliant complement, I think, to Birmingham, but also is exactly what we want to see from Blackyear. Blackyear is always about being generous with what we're doing and helping everyone work to address the inequalities and respond to them. So we have a really strong commitment to sharing the learning. This webinar is part of that journey. But we, as Councillor Khan mentioned at the beginning, Paulette, when she moved into Parliament, was really keen to champion this, as was her counterpart, Janet Dabby from Lewisham. They hosted a reception and we had a range of MPs and peers from the House of Lords who came to that to hear about the work and to help, and committing to helping support that us as we move forward. Through our communities public health team, we linked into a wider community of practice across the West Midlands. The National Director of Health Inequalities, Bola, has been immensely supportive of the Blackyear project, and I was with her yesterday just talking about how it has really helped her and the national team move from the rhetoric of there's a problem to actually how do we solve the problem. And the work that we're doing, they are actively helping us to promote and share. And we've continued to champion it internally with our staff, both within the council and within the NHS, and presented it on national platforms such as the Cooperative Councils Conference last year when it was in Birmingham. And we're really keen that people use Blackyear. How you use it and where you go next is completely up to you. But the opportunity of Blackyear is to change the future. And that's my kind of final reflection before I hand back to Councillor Khan and then we open to questions, is that this was 2 years of work. It was work that as a city we committed to, and we continue to work with our partners and our citizens during the pandemic, because this is fundamentally something we believe that will change the future, not just for African Caribbean communities in Birmingham, but as Councillor Khan alluded to, some of the stuff we've done, for example, around data has led us to question and reflect how we're collecting data on disabled communities, and led to a very, very different approach in that space. The work we're doing on cultural intelligence, we built a framework that, yes, we've built it and it has examples, and we've started with our African and Caribbean communities, but we're also building alongside that the resources and tools to go around the framework for our Gypsy and Roma communities, for example, because doing it this way, we're benefiting across a much wider footprint. So there are hundreds of hours of work of engagement and collaboration, and I add my thanks to Councillor Khan to those that have walked this journey with us, and to those that will continue to work with us as we move to the future. At the end of the day, this is one report, but my hope is that it leads to a much better future in Birmingham, but a much better future for everyone. So I'll stop sharing there, and Councillor Khan, I wonder if you want to say a few words before we open to questions.
Thank you. Thank you, Dr. Justin Varney. Yes, for me, I think it's just a quick point to note that I think that it's been a long and difficult journey that we've been on when it in relation to the work on Black Ear. And actually, when I came into post last year, I remember at that point thinking, it feels almost as though all of the hard work to get to the stage of having the report has been done, and I'm kind of stepping into that space kind of at the end and just being there at the official launch and things like that. But I realized at that point that actually all of the hard background work that needs to be done was obviously already completed by the time I was in post. And actually the real kind of critical point was when I feel like I entered into that space, was where the implementation stage took effect, and obviously that work is still. I'd say it's obviously it started. We've kind of come a long way, and you've heard from Dr. Justin Varney of all of the different sort of stages that we've currently gone through. But there's clearly still lots more work that needs to be done, and not just with African and Caribbean communities. And as we already mentioned, that this work is kind of like a blueprint for other communities to be able to see how there's health inequalities across the city, across different communities and different backgrounds, and I'm equally as proud when it comes to the work around the community health profiles, because it really, it's something that's not really, I'm not aware of any other local authority that's carried out such a critical, crucial, detailed piece of work like that. And it really just goes to show that public health in Birmingham has really taken the lead on, in a space that's so important, where we've got such a culturally diverse community. And so, yeah, so I there's a lot more work that does need to be done, but I know that with sort of 20 minutes left to go, I'd be really keen on hearing the thoughts and reflections from people that are on the call today. So I'm happy to start taking questions.